It really is an honor for me to be here today. Thank you so much, Denise, for inviting me to come here and talk with everyone. I want to start out by kind of sharing with you, I guess, my conception of what this talk was supposed to be. Denise emailed me and said that I should come and talk about who I am and why I got interested in digital technology and, of course, social media. And actually, no one had ever really asked me that question before, and it got me thinking. And I've always been an educator, and I really think at heart I'm a student in pretty much everything I do. I'm an expert in a few things, but a student in everything else. And so I'm going to talk today about what it's like to be a student and what digital technologies and what social media have helped me achieve as a student. And I think the first thing is meeting Denise. Denise is a remarkable individual. You're going to have to blush a little bit now. But I met Denise in Maastricht a few years ago, and of course she came to Stanford last year, and she helped me at the conference that I did moderate panels. But in addition to just seeing how bright she is and how she thinks about technology and healthcare, I think one of the things I really learned from Denise is if I'm going to be in this area of healthcare and technology, I need to be thinking outside of what's happening in Palo Alto. And I need to be here in Paris, and I need to be talking to people outside of Silicon Valley because there's a lot of amazing things happening in Europe. And in my opinion, there's no other person better who knows more than Denise. So Denise, thank you. And thank you for this amazing conference, by the way. I mean, it's just an honor to be here. And I think what you've done is incredible. So thank you very much. Of course, the other thing that social media has helped me achieve as a student is really learn from my patients. And not just my patients, but patients in general. And I think my greatest teachers as a physician have been patients. I've learned so much from them, and I think they have so much to tell us. I think, my hope is that the era of paternalistic medicine is coming to an end. And I really, truly believe in the model of participatory medicine. My friend and patient, Hugo Campos, I think, I'm going to steal a line from him, and he says, essentially, he's not an expert in physiology or cardiology or all the different types of medical sciences out there, but he is an expert in himself. And I think that's the important thing that, as a physician, we need to teach other people and other physicians about. Our patients are experts in themselves, and we really need to listen to them. And social media has really given patients that voice to let us understand what their expertise is, so that we can work together, physicians and patients, as partners to help them achieve their health goals. And that's a picture of me and Sarah. I don't know if you can see in the corner there, but that was at Stanford last year. This is a picture of some of the people that help me do what I do. And I think it's really important to acknowledge and thank people. And these are my students, and I learn from them every day as well. I don't think you, as a teacher, to teach somebody something, you have to learn and understand it so much more. And so they challenge me every day to keep learning about things and teach me a lot as well. So thank you. And Anna and Heather right over there. So thank you, guys. So the other things that I do, I teach at Stanford, and a lot of the things that I do in the AIM lab have to do with education and how we use social technologies and emerging technologies in medicine. And I think yesterday at the workshop I spoke a little bit about some of the educational projects and iPad apps that we developed, so I'm not going to really talk about them too much. But I will mention one thing in that area that's really exciting to me is the use of checklists and cognitive aids in medicine. And that's a really exciting use of emerging technologies that I'm interested in exploring, because we know that when a crisis happens, crisis resource management is very important. And just like pilots have a checklist for when their plane crashes, I think doctors need to have a checklist when a patient's heart stops, and so that we know the steps we need to follow in order to get the patient back and to get the heart restarted. And I'm really excited because we have a great collaboration with faculty members in the Human-Computer Interaction Group at Stanford in the Department of Computer Science. And over the past few years, we've developed a really exciting collaboration where they're helping us design dynamic cognitive aids that change over time based upon what's happening to the patient and direct people to work together as teams. And one of the things that I'm really excited about is design, and it's something that I've always been interested in, but I didn't really realize the importance of design until I started collaborating with Scott Clemmer and Stu Card from the Department of Computer Science. And they came and watched us. We have a fake hospital in the basement of the Stanford Medical School. It has all the equipment, all of the anesthesia machines, all of the surgical equipment, but it's fake. But we can go there and we can practice and we can simulate and we can create disasters and see what real doctors do. And by doing that, we really learned. It was a physician-centered design process. But I think the same analogy goes to patient-centered care and patient-centered design. And what are we doing to understand the patient experience and how we can use that to improve healthcare? Those are things that I'm also interested in. Another thing that I'm really excited about these days is self-tracking. It's something that I've been working on for a while, ever since I started my research program at Stanford 7 years ago. I study patients who suffer from chronic pain. We have been self-tracking. We've been asking our patients to fill out diaries every day. We call them on the phone and we get information about how they're feeling, what their pain levels are, what their side effects are, if they're sedated, how much pain medication they're taking. And we use all that information in real time. Every day I get information from my patients, and we figure out how to adjust their medication so we can optimize analgesia and we can minimize side effects. And I think self-tracking is really exciting because it dovetails very nicely with participatory medicine and this movement for us as physicians to engage with our patients. And when we're seeing a lot of new technologies coming out, consumer-facing sensors and devices that allow both active and passive tracking in real time to be able to share all this information. So it's a real exciting time for me, and I'm really excited to be learning about self-tracking and all the things people are doing with these technologies. Of course, being in Silicon Valley, the other treat that I have is I get to have lunch with people, and I get to meet people, and I get to see all the amazing stuff that's happening with technology in the Valley. And that's, I think, a true joy for me because it is such a creative area to be in. And a lot of the work we do in Medicine X is try to find the new greatest things to show people, to shine a light on. And shining a light on patients is one thing that I'm really passionate about. And I learn, as I said, so much from our patients and from hearing their stories and sharing their stories. And we saw today one of the films that we did with Sean Ahrens and his work with chronology. And we're really lucky because we get to go and talk to these patients. Hugo Campos and his whole story about access to his own medical data. Lisa Bernstein and Britt Moody, who some of you may know is Hurt Blogger. And this is a joy for me to learn from these patients and to be able to share their stories. And of course, the partnership that we have with Doctors 2.0. I think this whole concept of Paris and Palo Alto is perfect because it really does, I think, form a great alliance between two conferences that have that share very similar missions. Denise has always been passionate about including patients in her conferences. The first speaker today was a patient, and we have that similar vision and focus. And so it's really been exciting, the partnership that we have, Denise, and I look forward to things that we can do in the future together. I'm gonna end my talk with a painting that the beautiful, smart, amazing Regina Holiday who is a DC-based patient advocate and artist, painted for me. I asked her last year to paint a picture for me that would summarize my philosophy about Medicine X and what we should be doing. And so I'm going to finish just by reading a paragraph of her explanation. To the left of this piece, people are pushing their rafts upon the rising water. Here we have doctors, technologists, academics, designers, and patients trying to find common ground. Each uses the pole in his hands to move forward in the water. As the pole crosses before his body, each becomes the letter X. We, the patients, are the X in Medicine X. We are the mysterious other that has not been applied to the solution. We are the ever-arching story above and beyond the episode of care. Thank you.